Welcome to our Parasitology lecture. Today, we are going to explore a fascinating but terrifying creature known as Ancylostoma duodenale, commonly called the Old World hookworm. Imagine walking barefoot in a warm, moist field, completely unaware that tiny, invisible vampires are waiting in the soil. These microscopic creatures do not bite your neck. Instead, they silently burrow right through the intact skin of your feet. Understanding how this parasite operates is like studying a master thief that steals your body's most precious resource, your blood, without you even noticing until you feel exhausted and weak. Let us dive into its biology. Now that we know what we are dealing with, let us look at the physical structure of this parasite. Ancylostoma duodenale is formally classified as a parasitic nematode. It is historically found in Europe, North Africa, and Asia. Morphologically, the adult worms are quite small, measuring only about 1 centimeter in length, and have a grayish-white cylindrical appearance. But their most dangerous feature is their mouth. They possess a highly specialized cup-shaped buccal capsule equipped with 2 pairs of sharp, hook-like teeth. They use these teeth to anchor themselves firmly into the mucosal lining of the human small intestine. Once attached, the worm secretes anticoagulants to keep the host's blood flowing freely, ensuring a continuous meal. Understanding its physical structure leads us to ask why this specific parasite matters so much in the real world. The answer lies in the sheer scale of the damage it causes. Ancylostoma duodenale is one of the leading causes of iron deficiency anemia globally, particularly in developing nations where sanitation is poor. When millions of people, especially growing children and pregnant women, lose blood daily to these worms, the consequences are devastating. It leads to severe physical and cognitive developmental delays. Entire communities can suffer from reduced energy and economic productivity simply because these worms are quietly draining their vitality. We must understand this impact to break the chain of infection. To truly grasp the danger we just discussed, we must look at the mathematics of the infection. A single worm might seem harmless, but the severity of the disease is directly proportional to the worm burden, which is the total number of adult worms inside the host. This brings us to our first formula. The total daily blood loss, V total, is equal to N multiplied by V worm. Here, V total is the total volume of blood lost by the patient per day, measured in milliliters. N stands for the total number of adult worms currently residing in the patient's intestine. Finally, V worm represents the average volume of blood consumed and wasted by a single worm in one day, which is approximately 0.2 milliliters. If the number of worms increases, the total blood loss increases linearly, rapidly pushing the patient towards severe anemia. Before we move on, let us see this formula in action with a concrete clinical scenario. Imagine a young child from a rural village is brought to the clinic, presenting with severe fatigue and pale skin, which are classic signs of anemia. Through stool analysis, the doctor estimates that the child has a worm burden of 150 adult worms. We need to calculate the total amount of blood this child is losing every single day. We start with our formula, V total equals N times V worm. We substitute 150 for the number of worms and 0.2 for the daily blood consumption of a single worm. Multiplying these gives us 30.0. This means the child is losing 30 milliliters of blood every single day. This massive, continuous loss is like donating a full unit of blood every 2 weeks, explaining exactly why the child is experiencing severe fatigue. Now that we have calculated blood loss based on worm count, a practical question arises. How do we actually know how many worms are inside a patient? Doctors cannot simply look inside the intestine to count the worms, so they must estimate the worm burden using a different, non-invasive method. They do this by analyzing the patient's feces. A female Ancylostoma duodenale produces a massive, predictable number of eggs every single day. By measuring the total number of eggs excreted, we can work backward. It is a classic inverse problem where we use the visible output, the eggs, to calculate the hidden source, the female worms. This diagnostic approach is crucial for gauging the severity of the infection. This concept of working backward gives us our next important mathematical tool. To find the number of female worms, we use a simple division formula. N female equals E total divided by E worm. Let us break down these symbols. N female represents the total number of female worms residing in the gut. E total represents the total number of eggs excreted by the patient per day, which the laboratory measures. Finally, E worm represents the biological constant of eggs produced by one female worm per day, which is approximately 25,000. By dividing the massive total egg count by the individual output of a single worm, we mathematically isolate the number of female parasites. If the total egg count goes up, it directly indicates a higher population of female worms. Let us apply this inverse formula to a real laboratory result. Suppose a laboratory analysis reveals that a patient is excreting approximately 3 million eggs per day. We must determine the severity of the infection by finding out how many female worms are living in the patient's intestine. We set up our equation. N female equals E total divided by E worm. We substitute 3 million for the total eggs and 25,000 for the eggs per female worm. When we divide 3 million by 25,000, we get 120. This calculation reveals that there are exactly 120 female worms actively reproducing in the patient's intestine. This simple but powerful division allows us to see past the overwhelming total number of eggs and find the root cause of the infection. So we have successfully calculated the number of female worms. But this brings us to an important derivation. How do we find the total worm burden from just the females? Let us walk through the logic. The total worm burden, N total, must equal the number of female worms plus the number of male worms. Biologically, we know that the ratio of male to female worms in an infection is often roughly equal. Therefore, we can assume that N male is approximately equal to N female. Substituting this into our first equation, we find that the total worm burden is simply 2 times the number of female worms. Using our previous example of 120 female worms, we multiply by 2 to estimate a total burden of 240 worms. This diagnostic math allows physicians to tailor the dosage of antihelminthic drugs accurately. Now that we understand the math behind the damage and diagnosis, we must understand how the worm actually gets into the body. The life cycle of Ancylostoma duodenale is a remarkable journey of survival. It has a direct life cycle, meaning it does not require an intermediate host like a mosquito or a snail. It moves directly from the soil to the human. The cycle begins when eggs are passed in feces into warm, moist soil. Within a few days, they hatch into non-infective rhabdidiform larvae, which feed on bacteria and molt twice. They transform into infective filariform larvae, waiting near the soil surface. When a human steps on this soil, these larvae use special enzymes to penetrate the intact skin, usually between the toes. This invasion causes an itchy allergic reaction known as ground itch. After penetrating the skin, the larvae begin an incredible migration through the human body. Once inside, they enter the tiny blood vessels called venules and are carried by the bloodstream directly to the right side of the heart. From the heart, they are pumped into the lungs. Here, they physically break out of the pulmonary capillaries and enter the air sacs, or alveoli. They then crawl up the respiratory tract, moving up the trachea to the pharynx. At this point, the host unknowingly swallows them, sending them down through the stomach and into the small intestine. In this nutrient-rich environment, they molt a final time, mature into adult worms, attach to the intestinal wall, and begin the cycle anew by drinking blood and laying eggs. This incredible journey directly dictates how the disease develops, which occurs in 3 distinct stages of pathogenesis. First is the skin invasion stage, which we noted is characterized by the allergic ground itch. Second is the migration stage through the lungs. As the larvae break into the alveoli, they cause tiny hemorrhages and a condition called Loeffler's syndrome, marked by coughing and pneumonia. The third and most severe stage is the intestinal phase. As the adult worms attach to the mucosa, they cause mechanical damage and secrete anticoagulants. The host suffers from chronic gastrointestinal bleeding, leading to profound iron deficiency anemia and protein loss. In the most severe cases, the heart overworks to pump thin, oxygen-poor blood, which can ultimately lead to heart failure. Let us bring all of these concepts together by looking at this comprehensive life cycle diagram. On the left, you see the human host with the internal migration pathway clearly mapped out. Follow the arrows starting from the bottom. The infective larvae penetrate the skin of the foot, travel up the bloodstream to the heart, and enter the lungs. You can see the path moving up the trachea and down the esophagus, finally reaching the small intestine. On the right, notice the enlarged view of the adult worms, firmly attached to the mucosal wall where they feed. Following the cycle downward, eggs exit via feces into the soil environment, shown at the bottom. Here, the eggs hatch into rhabditiform larvae, which molt into the infective filariform larvae, ready to penetrate a new host. This visual perfectly summarizes the parasite's relentless journey. We have covered a lot of ground today, so let us reinforce the most important takeaways. First, Ancylostoma duodenale is a highly adapted parasite that causes immense global suffering simply by drinking blood. Second, we learned that we can mathematically model the severity of this infection. Daily blood loss is directly proportional to the worm burden, which we can estimate non-invasively using egg counts. Finally, we traced its remarkable direct life cycle, from soil to skin, through the lungs, and into the gut. Mastering the biology, mathematics, and epidemiology of this hookworm is the first critical step in diagnosing, treating, and eventually eradicating the devastating anemia it causes worldwide. You now have a solid, comprehensive understanding of this parasite.